The good news is that with this increase in cases, we have not seen a corresponding rapid increase in hospitalizations and ICU admissions. Today, we are reporting 965 people in hospital and 200 people in ICU due to COVID-related critical illness. This is thanks to the effectiveness of the vaccines and the willingness of Ontarians to embrace vaccination and prevention. It is also because Omicron is different from other variants. While it is clear it is more transmissible, preliminary findings from Public Health Ontario suggest Omicron is the first dominant variant to demonstrate a decline in disease severity. The risk of hospitalization or death was 54% lower for Omicron cases as compared to Delta cases. While this is good news, because Omicron is much more transmissible, it is expected that the number of hospitalizations and impacts on the healthcare system will be significant. And as we continue to see hospitalizations and ICU admissions increase, many individuals have noted the importance of distinguishing between patients admitted to hospital or the ICU for COVID-19 versus those admitted for other reasons, such as a broken bone or appendicitis, but also test positive for COVID-19. As a result, we have asked hospitals to update their daily reporting to include this important information and expect to begin receiving it, as well as adjusting our public reporting in the coming days. Omicron is a new enemy. We continue to prepare for it, but we must take a different approach and take further action to limit transmission, provide additional protection to high-risk settings, and continue to safeguard the Ontario hospitals in ICU capacity. Because of the rapid transmission of Omicron, many jurisdictions have had to adjust their testing strategies, and Ontario is no different. Beginning tomorrow, December 31st, publicly funded PCR testing will only be available for those vulnerable individuals, including those with significant medical issues who are symptomatic or at risk of severe disease from COVID-19, including for the purposes of confirming a COVID diagnosis prior to beginning treatments, and workers, residents, and others in the highest risk setting, such as hospitals, long-term care, retirement homes, and congregate living settings. In addition, most individuals with a positive result from a rapid antigen test will no longer be required or encouraged to get a confirmatory PCR or rapid molecular test. And there will be no testing for asymptomatic individuals in the community. This updated eligibility will ensure that those at highest risk of severe outcomes and those caring for them have timely access to test results. This, we recognize, reflects some significant changes from our previous COVID testing strategy, which meant that anyone with symptoms could receive a PCR test. But the Omicron variant is rapidly spreading, and we must preserve these resources for those who need them the most. I do hope that Ontarians will understand that we must together protect this limited resource for those that need it the most. Ontario also currently has a limited supply of rapid antigen tests, which is true around the globe, and that these are being preserved and prioritized for healthcare and high-risk settings to keep these settings safe. This means that if you have symptoms of COVID-19 and are not eligible for a PCR test and do not have access to a rapid antigen test, you should assume that you have COVID-19 and isolate according to our revised guidelines. These changes are in our testing are not unique in Ontario. Ontario is also changing the required isolation period based on growing evidence that generally healthy people with COVID-19 are most infectious for the 2 days before their symptoms develop and for 3 days after their symptoms. Individuals who are vaccinated, as well as children under 12, will be required to isolate for 5 days following the onset of symptoms. This also applies to their immediate household contacts. The isolation can end after 5 days if symptoms are resolved or improving for at least 24 hours, and all public health and safety measures such as masking and physical distancing are followed. If you have been exposed to someone who has tested positive for COVID-19, are fully vaccinated, have no symptoms, and don't live with the positive case, you are advised to continue to monitor for symptoms for 10 days from the time that you interacted last with that individual, and adhere to all public health measures when outside your home. Ontarians have been brilliant at protecting each other, and I know we will continue to do so through the basic public health measures of masking, hand hygiene, and distancing. Individuals who are unvaccinated, partially vaccinated, or immunocompromised will be required to isolate for 10 days as risk of the virus shedding continues in these individuals. Also, individuals who work or live in high-risk healthcare settings can return to work after 10 days from their last exposure or symptom onset or from their date of diagnosis. But to ensure sufficient staffing levels, workers have the opportunity to return to work after isolating for 7 days based on a negative PCR test on day 6 or 2 negative RAT tests at day 6 and 7. When it comes to case and contact management, I want to thank our incredible public health professionals for their tireless efforts. And now with the number of cases that we are seeing, public health must shift its focus. That means that positive cases in high-risk settings, such as long-term care homes, retirement homes, will receive case and contact management from public health. But other individual cases will be asked to identify and inform their own close contacts. This means that not everyone will get a call from public health with guidance or next steps. Our online screening tools will be updated so that lower risk individuals with COVID-19 symptoms will be instructed to isolate with their households and inform any additional contacts to monitor their symptoms. The key message will be simple. If you're sick, stay home. Please visit ontario.ca/exposed if you think or know you've been exposed to COVID-19 to access information on what you can do to protect yourself and your contacts. Along with changing to our testing and isolation guidelines, we're also making changes to our vaccine eligibility. Effective immediately, residents of long-term care homes, retirement homes, elder care lodges, and older adults living in other congregate settings will be eligible for a 4th dose of an mRNA vaccine if at least 3 months have passed since their 3rd dose. Many of these individuals are now likely becoming increasingly more susceptible to COVID-19 infection due to waning immunity from their previous doses. Individuals who work or live in high-risk settings can return to work after 10 days. In addition to bolstering the protection against the highly transmissible Omicron variant, the province will be mandating 3rd doses for staff, students, volunteers, caregivers, and support workers, and requiring visitors to provide proof of vaccine or a booster to enter the home once the temporary pause on general visitors is lifted. I also continue to encourage all those eligible for 1st, 2nd, and 3rd doses to get vaccinated as soon as possible. In regards to additional public health measures, to further strengthen our response to Omicron and reduce the spread of COVID-19 in large indoor settings, effective tomorrow, December 31st, Ontario will be restricting Spectator capacity to 50% of the usual seating capacity, or 1,000 people, whichever is less, in the indoor areas of the following settings: Spectator areas of facilities used for sports and recreational fitness activities, such as sporting events, concert venues, and theaters. Finally, I know many parents and students are anxious to hear about the return to school. I and colleagues from across Ontario have always maintained that schools should be the last to close and the first to open. It is critical to the positive mental health and academic success of our children. I am now able to confirm that students will be returning to school in-person learning on Wednesday, January 5th, 2022. This will provide our schools with extra time to begin to put in place additional health and safety measures, including deploying additional masking options for students and educators and further improving air ventilation in schools. These and other measures, including updating the COVID-19 school and childcare screener and asking students, parents, and staff for rigorous screening and monitoring of symptoms, creates more layers of protection to keep schools safe and open for in-person learning. In conclusion, I understand that we're all tired and just want this pandemic to be over. Unfortunately, though, we need to get through this Omicron wave. And we are asking even more of you as we prioritize our testing, prioritize our case and contact management, and ask you to take all the precautions necessary to protect yourselves and your families. Omicron has presented us with new challenges, and we've had to be flexible and adaptive in the face of this new variant. I'm hopeful that with the effort we are putting in now, 2022 will prove to be a year that we are able to get the better of this virus. I wish you all a very happy and safe new year. Thank you. Merci.